Denosumab, a powerful medication for osteoporosis, is known for its effectiveness in increasing bone mineral density and reducing fracture risk. However, one significant challenge with this therapy is what happens when patients stop taking it. Stopping denosumab can trigger a rebound effect, leading to rapid bone loss. The question is, can switching to another medication like Zoledronate, a type of bisphosphonate, help manage this risk? A recent study out of Taiwan sheds light on this issue. Researchers conducted a randomized trial involving 101 patients, most of them older women in their early 70s, who had been on denosumab for at least 2 years. Participants were divided into 2 groups, one continued with denosumab, while the other switched to a single intravenous dose of Zoledronate 6 months after their last denosumab treatment. 1 year later, researchers found that bone density results were mixed. In terms of total hip and femoral neck density, there was no significant difference between the 2 groups. But when it came to spinal bone density, the Zoledronate group experienced a noticeable decline compared to those who stayed on denosumab. Interestingly, this loss was more pronounced in patients who had been on denosumab for 3 years or longer before making the switch. So, what does this mean for patients and their healthcare providers? The findings suggest that switching to Zoledronate after denosumab may not fully prevent rebound bone loss, particularly for those with longer treatment histories. For patients who have been on denosumab for shorter periods, Zoledronate might still be a viable option. The study emphasizes the importance of clear communication with patients about the long-term nature of denosumab therapy. Specialists often oversee these treatments, but primary care doctors play a key role in advising patients about referrals and long-term management plans. Patients need to understand that indefinite use of denosumab is generally recommended unless there are compelling reasons to stop. An editorial accompanying the study also highlights strategies for discussing this sensitive topic with patients who might want or need to discontinue denosumab. The key takeaway? Stopping denosumab requires careful planning, and switching to another medication like Zoledronate may not always provide a full safety net against bone loss. For now, patients and providers should weigh the risks and benefits together, always with an eye on preserving bone health for the long haul.